Innovations in testing, treatment, and education have helped reduce the spread of HIV, but misinformation can sometimes lead to behaviors that put people at risk for contracting that disease. Let's take a look at some of the most common fictions and then get right to the facts. Fiction: I can get HIV from touching, swimming with, sharing a drink with, using a toilet seat after an infected person. HIV is transmitted through specific bodily fluids only. You can be exposed through unprotected vaginal or anal sex with someone who is HIV positive. And because anal tissue is especially fragile, those who receive anal sex are particularly at risk. You can also be exposed to the blood of a person living with HIV infection who is not receiving treatment. One way this happens is through needle sharing or accidental needle stick injuries. Finally, a mother can pass HIV to her infant through childbirth or breastfeeding. Fiction: with all the new treatment options available, HIV is more or less cured. Nothing can cure or completely get rid of HIV. It's a lifelong infection, but with proper therapy, it doesn't progress to AIDS. It's treated with combination antiretroviral therapy, also known as ART, that consists of at least 3 drugs that stop the virus from replicating. Today, most ART regimens are combinations of medications all in a single pill that is taken once a day with minimal to no side effects. By fully complying with treatment, people with HIV can live lifelong and healthy lives. Fiction: I don't feel sick. There's no reason to get tested. Many people living with HIV have no symptoms, even though they can still easily spread the virus to others. If it goes undiagnosed or treated, people living with HIV will eventually develop immune deficiency and will be at risk for opportunistic infections and cancers. The CDC recommends everyone between 16 and 65 get tested for HIV at least one time. Sexually active adults, especially those with multiple or anonymous partners, should be tested more often. Fiction: HIV tests aren't accurate until months after possible exposure. We can now accurately test for HIV within weeks of infection. Third-generation tests look for our body's antibodies to HIV and detects the virus as early as 1 to 3 months after potential exposure. Fourth-generation tests look for both those antibodies and the HIV virus itself within 2 to 4 weeks. The tests use blood or saliva and are extremely accurate and trustworthy. They're some of the best diagnostic tests in medicine. Fiction: medications are only for people who've already contracted HIV. While there's no HIV vaccine, there is a medication that can lower your chances of contracting the virus, especially if you're considered high risk. For example, your sex partner is HIV positive or you share needles. This strategy, pre-exposure prophylaxis, or PrEP, uses a daily medication known as Truvada that can lower your risk of infection by 95% or more when taken correctly. University of Utah Health is a leader in HIV prevention and treatment. Contact us. We're here to answer your questions or schedule an appointment today.